Hi, Namaste. This side Rupali Gupta Tiwari, and today's conversation is not just about medicine. It is about powerful intersection of science and hope and embracing parenthood. So today's topic is decoding fertility and IVF, science, emotions and modern possibilities. So today I have the privilege of sitting with someone who has brought smiles and happiness in the life of many who were dreaming of becoming parents. So let us all welcome Dr. Bhavya Jha, one of the most respected IVF fertility expert in the country. She is not known just for her expertise in complex cases, but also treating every patient like a family.
Thank you, Rupali, for your kind words, and it's a privilege being here, having a podcast with you. Thank you.
Okay. So, Dr. Bhavya, before we get into the science, so I just want to understand the human being behind the doctor. So, what made you choose this crucial path? Why fertility? Why IVF?
So, it's been a very, very long journey. So, when I was doing my master's in obstetrics and gynecology, in a government hospital setup, we usually don't have IVF labs or, IVF units. We do not get to learn so much during our training in the government colleges. But after that, when I went to LNJP hospital in Delhi, over there they did have a IVF unit. Though I was not part of that IVF unit, I was in the oncology unit at that time. Okay. But somehow IVF and fertility really attracted me. I would secretly go and sit in the IVF OPD and start seeing the patients over there. And what attracted me there was the patients who came, they were like really desperate. बहुत रोते थे, बहुत दुखी होते थे, just to have a child. And somewhere that hit me, that touched my soul. I would actually go inside the IVF lab just to check कि really a life is being created here. I mean, generally life is created inside another human being. Yeah. But in that room, in that IVF lab, we were creating lives. Again, that hit me really hard and attracted me a lot. And that is the time when I decided that I have to learn more about this branch and pursued my dreams further on.
Yeah, great, ma'am. Very inspiring. So, ma'am, you have been into this journey for long now. So, is there any particular case जो आज भी आपको याद है?
So, a very interesting case, and somehow it touched me a lot, and in a positive as well as in a negative way. In 2017, we were doing surrogacy at that time. There were two couples we were doing surrogacy for, and there was a couple from Canada, and then there was one couple from Jalandhar. Somehow both the surrogates were delivering in the same hospital on the same day. Both were admitted, and I was the doctor over there to deliver both of them. So around 1:30 at night, I had gone to deliver one surrogate, and the baby was of the other couple who was still coming from Jalandhar on the way, and the couple from Canada was already in town. So once delivered, it was a baby girl. Of course, it was late night, so the the administration team and all were not there. I handed over the baby to the nurse. The pediatrician said कि एक रात रखना पड़ेगा. Next morning we are going to hand over the baby. I delivered everything safe, went back home, and morning 6:30 I got another call for the other surrogate. She went into labor. So that time I went and delivered the other baby, and that was of the couple from Canada. The couple from Canada were between 45 to 50 years of age, around 18 years of married life, must have visited 20-25 IVF clinics from across Canada to America to India, and finally their surrogate was delivering. Once when I announced that your surrogate just delivered and congratulations, you had a baby girl, they said no. The sister told me last night that our surrogate has delivered and it's a baby boy. I said, sorry, there is some major confusion over here. The surrogate who delivered at 1:30 at night was for a couple from Jalandhar. It wasn't your baby. I'll just clear that off. Then of course everything is barcoded and everything is in place, but sister made the error, the NICU NICU sister. So then I showed the barcode and all the papers and everything, and finally they accepted that they got a baby girl and not a baby boy. But whatever, I was like, after 18 years through surrogacy, they had a child. They should be elated. Once they accepted that there was a minor error and they had a baby girl, they started howling.
So is it so?
Yes, because they did not want a girl.
Oh my God.
And it broke my heart. I mean, being a mother of a girl, I celebrate her every minute. And that couple who's waited for like 2 decades for a child got a baby girl through surrogacy and started howling because. So, it hit me that wherever we may reach, I mean, you study so much, wherever you go to Canada or USA, that mindset doesn't
Never
go at
changes.
all. But then they accepted the baby and hopefully she's good today.
I just got goosebumps. Oh my God. So ma'am, what keeps you going in such a sensitive field?
Yeah, so fertility and IVF is something which has its own ups and downs. It's a well-known accepted fact that every couple cannot get a 100% positive result in IVF. Generally, the success rate varies between 50 to 60, if it's a very good case, 70%. So, of course, there are a lot of heartbreaks. Many patients do go through a lot of heartbreaks. But the patients who successfully become parents through IVF, of course, they are extremely happy. Their positivity, their encouragement, their gratitude, that keeps me going. But then there is another segment of patients who have not had that success. Their heartbreaks, I have had sleepless nights thinking about them. Somewhere I get really attached to them. I don't do it on a very professional basis. I keep thinking about those patients. What new can I do? What can I add? What can I subtract? And I think about their problems because, these patients get... their journey gets attached to you for a very long time. You know their in-laws, you know their mother, father, parents, siblings, you know so much about them and what stress they are going through. So all those things keep coming in my mind and I take it as a challenge that, okay, this patient is trusting me with another cycle. I have to give them a positive pregnancy at any cost. The third factor that keeps me going is one and only God. I'm a very spiritual person and I think there is so much beyond science. If He wants to give it to you, He will. I mean, I've had n number of cases now. During the start of my career, I did not understand that. But 10 years down the line, I have seen so many cases where in my heart I know it's such a challenging case. Probably this patient will not get through. It will not have a successful IVF pregnancy. But they've had positive results, they've had children, and then I know there is someone beyond us. There is a divine power. So I'm very spiritual, and every time I'm waiting for some results, some patient's results, which keeps happening on and off on a daily basis. I actually pray for that patient when I'm doing my prayers every day.
It's amazing to hear that, because I personally believe कि एक कहते हैं ना कि भगवान हर जगह नहीं हो सकते, वो अपने किसी ना किसी को भेज देते हैं अपने रूप में. सो आई ट्रूली फील दैट यू आर वन ऑफ दैट, सेइंग दैट यू प्रे फॉर योर पेशेंट्स, यू आर टोटली इन्वॉल्व विद देयर कंप्लीट जर्नी. So it's really, I think your patients are really blessed to have you.
I try my best to do that.
Yeah.
It's my basic nature. There's no effort for that.
So ma'am, let's start with the basic. When we say infertility, what does that mean medically?
Any couple, young couple, less than 35 years, has been trying for 1 year without using any contraception, any form of contraception. After that, and has not been able to successfully get pregnant, then we tell them to see a fertility doctor. And if the couple is more than 35 years of age and has been trying since 6 months and not successfully got pregnant, then we tell them to see a fertility doctor. So it varies for both. The age factor is the main thing, and this criteria has been given by the WHO.
So at what age, at around what age the couple should start worrying? Is it like around
So
35?
it's not like that. Any couple who's married and who wants to have a pregnancy and has been trying since 1 year, be it 28-year-old, be it 25-year-old, be it 32-year-old, if successfully trying since 1 year and not getting pregnant, that means there is something which is lacking.
Okay.
So you have to see. And if you are in advanced age group, 35 plus, then I think after few months of trial, you must see a fertility doctor.
Thanks, Dr. Bhavya, for just putting a light on this issue, because this is a major thing. Like people think that कर लेते हैं try, let us try, but they are not aware about the age.
Yes.
कि 28 में भी अगर problem है तो we must see a doctor.
Yes.
Okay. So what are the 5 causes of infertility, both in males and females?
See, causes are multiple, but if you ask me top 5 causes, then I would say first would be the age factor. So now the childbearing age has increased a lot for both husband and wife.
Exactly.
Yeah, so that is one factor. The second one would be poor lifestyle. That includes the food habits as well as the exercises and the lifestyle actually. The third, I would say pathologies. Like there could be uterine causes like fibroids, PCOD, endometriosis. So these are the pathologies which hamper fertility. Then the fourth, I would say male factor, poor sperm health, poor sperm count, quality. And the fifth, I would say pelvic infections. So there are a lot of infections during the reproductive age group, which many a times women don't realize, and that causes tubal blockage, endometritis, sometimes damaging the endometrium. So these are the, I think, top 5 causes of infertility.
So ma'am, infertility can be due to both male and female.
Definitely.
Then I must say that why in our society till today women are only blamed in majority of the areas. Like अगर conceive नहीं हो पा रहा है तो women में ही कुछ, इसमें ही कुछ गलती होगी, इसमें ही कुछ problem होगी. But I must clear the thing that as Dr. Bhavya told that it can be anyone. It can be due to the husband.
In fact, the load is about 40% of both the sides. Yes. It's not like minimal 10-20%. We see n number of cases with very poor sperm counts now.
So how is lifestyle affecting fertility today?
Lifestyle has a very massive role. So in our normal middle class setup, what happens that the child, once the school is over, after 11th, 12th, they go to the college. Then till they get married, they don't even try to get a blood test done.
Yeah.
In their college, they're eating from the ordering and eating from the canteen and all kind of unhealthy food. So that age group, the reproductive health during that 13, 14, 15 years of life, that is the time when it really gets destroyed. Then they start smoking, drinking. This has become the part of lifestyle even for men as well as women. So by the time they settle down in life in the late 20s and after 30s, they come to us for kids, and when we get the tests done, a lot of damage has already been done. So what is important in our primary school setup only, healthy eating habits, junk food, knowledge about junk food, healthy food, everything should be grilled in the kids. Yeah. Completely grilled. And of course the responsibility goes on the parents also. Like our market is stuffed with garbage. It's every food which is cheaply available is junk, and everything that is healthy, that has become so expensive.
Exactly.
So people are consuming that kind of, kids are eating chips, chocolates every day, and that becomes a lifestyle over the years. And too much of damage gets done,
and it is highly acceptable.
Yes.
Okay. Ma'am, there is just one question and it is from my side. Like जैसे पहले क्या होता था, there was a particular age like 24, 25, 28. 24 to 28 की एक विंडो थी कि द चाइल्ड शुड बी मैरिड, है ना, लड़की है या लड़का है उसकी शादी कर दो, है ना. बट नाउ द ट्रेंड हैज़ चेंज्ड, इट इज़ 30, 31, 35. सो विल इट इम्पैक्ट द फर्टिलिटी रेट इन फ्यूचर?
It has already started impacting actually. So these days every every one couple in six couple is actually requiring IVF.
Oh my God.
So that's a huge number.
Huge number.
And what happens with the girls especially, that the egg count. So girls at puberty have about 4 to 5 million of eggs, and that starts declining every cycle. When she has her menstruation, she starts losing eggs from the time of menarche, when she attains her puberty. And by the time she actually plans in her 30s, 70-80% of the eggs are already lost.
Oh.
Okay, so by the time girls start planning, the amount which is left is a very, very small percentage. But that is enough for you to get pregnant. But it should not. I mean, that time should not be wasted. So age impacts fertility very, very hugely, even for men. But for women, God has been a little partial. So men still have edge of around 10 years more. I would say after 40s it starts declining. For women, after 30 it starts declining, and after 35, severe decline is there.
Okay. So ma'am, I just want to clear about a topic like egg freezing in younger girl these days.
Yeah, so this topic is something which needs to be discussed.
Yes.
And every young girl must know about it. So what happens, like I told you, the egg starts declining very massively after 30. So the right age to freeze eggs, I would say, would be late 20s and early 30s. So after 27, between 27 to 32 is the right age group to start thinking of freezing your eggs, because after 32 many a times the decline is very massive. And if you freeze very few number of eggs, finally, why are you freezing eggs? So that when you become you are late in your 30s or 40s, and when you plan your baby, that egg should come of some use to you to get you pregnancy.
Yeah.
If the numbers frozen is very low, so then it does not help. Or if it's after 35, then that will carry the genetic issues like high chances of Downs, Edwards-Patau syndrome, which is very common in advanced age group women. So the earlier you freeze your eggs, the better, because you'll get a bigger pool of eggs which is getting freezed, number one. Secondly, the genetic risks that advanced age, maternal age carries will be less in those eggs. So the right age would be late 20s. And like we know, every woman now wants to be a career woman. Most of us are very ambitious, and I think that's the time we must. But we have to be smart along with that. So freezing of egg is a very, very good option, and everyone should avail for it. So even when you're 40, 45, you have younger egg frozen.
Yeah.
You can have your own genetically linked healthy embryos, and they can turn into babies.
Yes, I believe that quality is also good.
Yes, preserved,
Yeah.
of course.
Okay. So ma'am, I believe that we all are professionally growing and at a very fast pace, but emotionally and physically we are exhausting. So is it true?
I
So from
agree to
doctor's
that.
perspective, I
Yeah,
just
of
want to
course,
know.
we are becoming very, very ambitious in the materialistic world.
Yes.
But things that really matter, like something like child, gets compromised in the way.
Yeah.
Yeah.
So ma'am, IVF for many people is still a scary word. IVF जो भी सुनता है ना, तो एक बार तो डर जाता है कि अच्छा IVF करवाना है. और सेकेंड थिंग क्या है, पीपल कंसिडर इट एज अ लास्ट ऑप्शन कि अब कुछ नहीं हो रहा, अपना हमने सब ट्राई कर लिया, नाउ गो फॉर IVF, नाउ कंसल्ट अ डॉक्टर. सो व्हाट एग्जैक्टली IVF इज फॉर अ लेमैन?
Okay, so IVF, again, like you said, everyone is scared of it. I know that part. Everyone is scared of it, and no one wants to go through it in the first go.
Yeah.
And that's completely understandable. And even we don't pressurize. So, IVF is not always the first thing that we offer. There are multiple fertility options. Even with medicines, few simple scans, few very simple procedures, patients who are not able to get pregnant since many years do get pregnant. So IVF is not for all. It's for very advanced infertile cases. Otherwise, we have many easier options. And IVF otherwise is a process in which we extract the eggs of the women. by a very, very simple procedure. She goes through 10 days of injections every day on her tummy, and then those eggs are extracted. Sperm from the husband is taken. One egg and one healthy sperm that is fertilized, and it is cultured for next 3 to 5 days, and we make the baby out of it in the IVF lab. Mostly in the coming next cycle, we prepare the endometrial lining, and at the right place, we put that baby that we have created in the uterine cavity at the right place for it to implant.
Okay.
So generally it is a 2 to 3 step process, and on an average it takes about 3 months, and after the baby has been implanted in the uterine cavity, we get results after 2 weeks.
So ma'am, if a couple decides to proceed with IVF process, so what are the basic steps involved in it?
Yeah, so the basic, once they come for the IVF, we do a complete workup of the husband and wife. So bloods are done.
Counselings are done.
Counseling is done. Everything is, especially the success rate, the finances, everything is explained. And like I told you, all the blood work is done. Anything that is haywire needs to be addressed before the IVF starts. We might put them on some pre-treatment, some antioxidants and medicines. And then from day 2 of the period cycle, injections are given for 10 to 12 days usually. And under anesthesia, the eggs would be extracted, and they are preserved. Then the husband's sperm is collected, and healthy sperms from there also gets extracted, and then ICSI is done. Generally ICSI or IVF can be done. Preferably we do ICSI these days with, for good success rate, and then embryos are formed in 5 days. Generally we cryopreserve the embryos, and in the next cycle, in the fresh cycle, we plan for the embryo transfer, and that is done after endometrial preparation after 15 to 20 days of your period cycle. It's quite simple, but the tough part of the whole procedure, I feel, is the medicines and the injections. Yes, because taking daily injections and then taking so much of medicine, that becomes tedious for the patients. But once the heartbeat comes, we start tapering down the medicines. By the time first trimester is over, most of the IVF medicines are tapered down. Then it becomes like a normal pregnancy. And any patient who comes to that stage carrying a 3-month-old baby inside of her, and then if you ask her, she says, "Ma'am, it was worth it."
Yeah.
इतना तो हम कर लेते, because now she's pregnant.
Yeah.
So it's all worth the pain.
Exactly. So कहते हैं ना कि motherhood सबसे अच्छी journey है, and ma'am, you are a part of it. Okay, ma'am, as you mentioned the success rate. So what is the success rate of this IVF treatment, as there are various myths around, like कि अगर first time में success हो जाए तो हो जाएगा, otherwise नहीं होगा. So is it like that?
So what I tell my patients also, IVF, you have to take at least 3 cycles on your mind. Okay, it's not like not a procedure where you are adding 2 plus 2 plus 2 and you get a number. It's not accountancy.
Yeah.
It's science. You are creating a life. So any patient who starts with the IVF procedure should be prepared for 3 cycles in their mind, because sometimes something does not click, then we correct that part of it, then it clicks. So there the counseling actually plays a role. So when they come in for IVF and they are preparing for it, they must know what they are getting into. Okay, you should not give them a rosy picture that bas ek cycle lagega aur nikal jayega. It happens. I think 50-60% of the people, they do get through in one cycle, in the first cycle.
Yeah.
But then all cases are not same. There are a lot of complexities. You don't know how the uterus is, you don't know what genetic abnormality the embryo is carrying. So many things are there. So success rate, I would say, varies between 40 to 70%. 40% for those people, especially with very advanced age. So, late 30s and 40s, because as I told you, egg quality, where the number declines, the quality also definitely declines. So, that plays an important part. Then those patients who have a very poor uterus filled with fibroids, no matter how many surgeries are done, the effect of fibroids, adenomyosis, endometriosis, all that is still there. So poor uterine health is one thing where the success rate is low. Otherwise, in simple cases like PCOD, tubal block, poor low sperm count, these have very good success rate, as high as 70-75%. So that's why there's a range. We can't put all patients with 50% success rate. We know that some have lower success rate, some have very high success rate, so it depends from patient to patient. But yes, having realistic expectation from this procedure is the smart way to go. It hurts less also for the patients when you're prepared. It's all about mind.
Yes, exactly.
It's all about mind. With your mindset, you can defeat the whole world.
आई बिलीव मैम कि मदरहुड ऐसी जर्नी है कि इसमें जो एक वुमेन है वो हर चीज़ को हैप्पीली एक्सेप्ट करती है कि इफ़ आई एम गेटिंग माई बेबी तो लेट इट बी, तो वो पेन भी ना एक छोटा लगता है.
सही बात है. मतलब
ओके, so great ma'am, great insight. So ma'am, can we just have a rapid fire about the myths which are revolving around and what the reality is? So ma'am, can you just answer me in just true, false and a single liner? So the first thing which is hyped in the market is IVF babies are not natural babies.
False. They are natural, created in lab with your own sperm and eggs, with a lot of science and lot of love.
Yeah, so no discrimination need to be done.
Not at all. Equally intelligent and healthy.
Good. So IVF always leads to twins.
False. Many a times we do implant 2 embryos at a time, but not necessary that that will go into a twin baby only. It could be single also.
So, most common myth, only women are responsible for infertility.
No, not at all.
They are always blamed for, I don't know why.
False, 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 false.
Yes, it is false.
Men and women equally responsible.
Yes, men are equally responsible. So, IVF is the last option.
Yes, like as in with natural treatment, if you say that when the natural treatment exhaust, then we go for IVF. But if multiple IVF failures are there, then we have surrogacy, and with surrogacy we have had multiple success rates.
Great. So thank you, Dr. Bhavya, for such an insightful session. So I think most of the myths and the reality of IVF is cleared. So thank you for your time, for your heart, and for your insight. So, and to all of you, signing off, Rupali Gupta Tiwari.
Thank you, Rupali. The pleasure was all mine.